Freedom, not force! Freedom, not force!
As we told you this week, the decision on whether to get a COVID vaccine is a divisive one in the Miami Valley. Some healthcare workers and their supporters rallied protesting three of our biggest healthcare providers' decision to require vaccination. The controversy comes at a time when kids are going back to school and some parents are still deciding whether to get their kid a COVID vaccine. Right now, Pfizer's vaccine is the only shot approved for kids 12 and up, but there are no vaccines available for those 12 and under. For those under 12. And a new study from the nonprofit Kaiser Family Foundation shows 40% of parents of children under 12 want to wait and see before they get them vaccinated. But about 25% of parents with kids between the ages of 5 and 11 said they'll get their child the shot as soon as it's available. And 20% of parents with kids under 5 said the same. News Center 7's Cheryl McHenry continued her conversation with one of the country's leading vaccine researchers about where vaccine trials among younger kids stand now and when the shot could be available to them.
Talking now with Dr. Bob Frank, head of the vaccine research at Cincinnati Children's. Dr. Frank, what's the status right now of the vaccine trials in younger children?
So the vaccine, the Pfizer vaccine, has been approved for 12 years of age and above, and we're currently conducting studies with both Pfizer and Moderna going down as low as 6 months of age. The next step would be for availability in the community, probably be 5 to 12-year-olds, and that really it could be as early as next month. It may be December, January before it would be available. It's really going to depend on the FDA's decision.
So it's possible, though, sometime this fall that children younger than 12 will be eligible to be vaccinated.
Yes, it's possible that 5 to 12-year-olds could be vaccinated as early as next month. The FDA is going to review the data, and it's going to be depending on that and really what's going on with COVID in the community.
We know there's still a lot of controversy over people getting vaccinated. Why should parents get their kids vaccinated?
Well, I think there's two reasons. One is the direct effect, is that we've now had well over 300 children in the United States that have died from COVID. These have been perfectly normal, healthy children. And compare that to flu, is that on a bad flu year, it's about 100 to 120 children. So about 3 times the number that we lose from flu. The other thing is the over 18,000 children have been hospitalized. And we also have the indirect effect as far as the children transmitting to adults. As of a couple weeks ago, 24% of all the new infections of COVID in the United States were in children under 18, and they only make up 17% of the population. So we're seeing now an overrepresentation of infections in children.
With school starting and vaccines not yet available for kids under 12, what should parents be doing to protect kids in the meantime?
Your mask. Is that the best thing that we have right now for children that don't have opportunity to have vaccine is mask and appropriate distancing. Is that we have studies to show that masks alone are about 82% protective, and the appropriate distancing is somewhere around 80%. So that adding the two of those together, it can't be any less than 82%. My guess is that you're going to get more, so probably closer to 90% protection.
All right, Dr. Frank, thank you.
And to see more of our coverage about vaccines and where the approval process stands now, go to WHIO.com. There we've also posted more of Cheryl's continued conversations with Dr. Frank. You can also find more of our vaccine stories on our free streaming app, WHIO TV Now.